Welcome to The Healthiest Argument. I'm your host, Caroline.
And I'm your co-host, Christina.
Please note that the Healthiest Argument podcast is for entertainment purposes only and is not intended to be used as medical advice. Please consult your doctor for personalized medical care.
Every episode will dive into the latest research and tackle a hot topic in health and wellness.
We'll each take a side, debate the pros and cons, and invite you to decide who takes the crown in the healthiest argument. Hello, and welcome to episode 1.
Hey, everybody. Welcome to the Healthiest Argument
Podcast.
Coffee versus
Tea.
all right.
I'm Caroline, by the way.
And this is Christina.
So let's talk a little bit about this subject. So, Christina, what's your relationship with tea?
My relationship with tea is one that is not as fulfilling as my relationship with coffee.
Oh, wait, did I ask you what your relationship with tea is? I'm coffee.
Yes. Well, I mean, this can go either way, I suppose.
So, Christina, what is your relationship with coffee?
Well, interesting you ask. I've been acquainted to coffee since I'm a baby. In my culture, or part of my culture, it's common for us to introduce coffee to the infant from the time it's in a bottle.
Oh, wow.
I know. Isn't that something?
That is something. I have some research layered I would love to share with you about coffee and the child.
I'm sure some people might frown on that, but here I am today. Okay, yeah, it's fine. And tell me, what about you?
So my relationship with coffee actually started when I was able to drink it, probably in high school when my parents allowed me to. I love coffee. My dad loves coffee, and that's really what got me into coffee. But recently, I became more of a tea lover after a trip to Japan last year. We learned a lot about tea in our journey and also took a tea ceremony class where we learned about the history of Japanese tea, the making of matcha tea, and kind of like the ceremonial rites and vibes to it. It was definitely very eye-opening. So since then, I've been more of a tea lover.
Very interesting. So it's interesting that you mention matcha because I've heard that there are different grades of matcha, and you should actually be selective about which grade of matcha you should pick out when you're shopping for it.
Yes, definitely there is ceremonial grade, which is best for drinking, is what we kind of really learned in our trip.
Have you been able to tell the difference in the different matchas since then?
Yes, definitely. We picked up some matcha to come home with, and it definitely had a more leafy is the right word, fresher taste to it. They also have, different intensities as well. So that's what we know.
Interesting. Yeah, I've heard that the non-ceremonial grade they can be high in metals and such. So definitely be wary of that.
So kind of talking about the history of the two, the origins of tea actually came from 2732 BC, a emperor of the name Shen Nung. So he said that one day the leaves of a wild tree accidentally infused into his hot water, coincidentally just plopped in, and it created a pleasant scent and an invigorating feeling when he went ahead and took a sip. And today, tea is the second most consumed beverage after water, with over 3,000 types of tea.
Very interesting. Well, did you know about coffee? They say that there was an Ethiopian goat herder whose goats would eat the berries and the leaves around certain trees. And after the goats consumed those berries and leaves, they noticed that the goats had more energy. So they went ahead and experimented with the product of this tree. And sure enough, they came across coffee and its caffeinating effects.
Wow, we got goats to thank for that. That is so crazy.
Isn't that something? Usually we accidentally find these things or incidentally come across something we didn't think it would be.
Yes, thank God for those goats, right?
So not only have we come across these different ways for consuming coffee, first it started off, in the form of the bean, and then eventually, so we went from eating to then learning we could grind it, and then to brewing, and we've come up with all these fancy ways to brew your coffee. So that's something really interesting. But something I've also heard about tea is that though most people don't know, we're used to letting it seep in the hot water. You can actually eat your leaves as well.
Wow, what is your favorite way of having coffee?
Great question. So I'm actually an Americano kind of girl, or just a plain black cup of hot coffee.
I like an iced Americano.
Oh,
That is very good. I'm an espresso lover.
oh, there you are. There you have it.
Not as much as tea, but probably equal.
Oh, okay. And do you have your favorite? What's your favorite of the tea selections?
That is really, wow, what a great question. I guess it depends on my mood since it's so versatile. I do love a matcha, but not always. I do like my herbal teas as well if I'm in a fruity kind of mood. But you can never go wrong with a green tea.
Fair enough. Fair enough. Well, something interesting about green tea, I think that you might have more to chime in about this, is green tea high in like metabolizing or something to that extent?
That is correct. Green tea does have high metabolizing properties. They use a lot of extracts in quote unquote fat burner goals. It also has epigallocatechin, also known as EGCG, which is helpful in reducing the complications of COVID.
Interesting.
But maybe that's more of the antioxidant, anti-inflammatory properties of green tea.
Yeah, I could see that. I could see that being anti-inflammatory. Interesting. So, talking about anti-inflammatory, not only does tea have some nice anti-inflammatory process or anti-inflammatory properties, but coffee actually is has its fair share in antioxidant properties. And did you know that coffee is actually one of the highest antioxidant containing drinks or consumption that is used in the United States?
Well, I do know that black tea and green tea and white tea all have research-backed anti-inflammatory properties and antioxidants, also high flavonoids, and all those antioxidants help with disease, such as antimicrobial, antifungal, specifically anti-cancer properties, bacteria, and it helps with bacterial infections and also dental caries, so your cavities as such.
All right. So I know we're talking about all of this antioxidant property, but can we go ahead and give praise to the EGCG? I'm not going to try it. EGCG.
Chastity Galley?
There we go. So it's actually a polyphenol, and that's who we have to give the praise to. Thank you to these polyphenols. They're the number one in this process.
Yes, these polyphenols help with potential improvements of your cardiac condition. So, any underlying or a history of cardiovascular conditions. It also helps strengthen the immune system. There's some research on blood pressure effects too, which we can kind of talk about later.
So, interestingly enough, the polyphenols, though they are definitely in tea, guess what? We actually have them in coffee as well. So a little fun fact there, polyphenols are in anything pretty much that comes from the earth. So anything green, you've got coffee, you've got tea, fruits, plants, seeds, and so on. So it actually also contributes to the coloring of these things.
Oh, wow. I know some polyphenols like catechins and theoflavins, those that are found in tea actually help with respiratory health to fight the inflammation of respiratory diseases caused by bacteria, viruses, things like that.
Well, the polyphenol is found in a variety of things, but there's an interesting study where there was a 28-year-old postpartum woman who ended up developing acute hepatitis, and it was actually linked to her consumption of this specific tea on a daily basis, and she was doing it to try to enhance her lactation output. So, all things in moderation, as they say.
So can we say that polyphenols are quote unquote healthy?
Do we dare? Do we dare say that? I will say there was also note to the consumption of the polyphenols, right? And the its inhibitory property for iron bioavailability. So basically it competes with the ability for the body to absorb it in the body, the iron in the body when we have that polyphenol consumption. So definitely something to think about.
So what would happen if the body can't absorb iron? Is that something that's important to us?
Of course. And so we are definitely concerned for like our patients with maybe some iron deficiency anemia or some other anemia issues that they may have, amongst other things as well.
That definitely makes a lot of sense.
So I know we were mentioning about the polyphenols and how they are mostly good for us. So we do definitely want to get some in our diet, right? But interesting, even if it's coffee or tea, did you know that if you add lactose to your coffee or tea, that you can actually inhibit the absorption of the polyphenol, therefore making any of those properties that we also desire not available to us?
Wow, I know when I have a latte, I like to enjoy it with some milk.
Well, if you're looking for animal milk, then guess what? You're out of luck, Chuck, with your polyphenols.
You said it's based on the lactose?
It's the lactose.
Oh, okay. Okay.
So if you like to consume your tea or your coffee with some cream or milk product, then maybe looking into a milk alternative would be a good idea.
Or lactose alternative, lactose free.
Lactose? No, I think any part of the lactase because it inhibits the actual absorption of it. So
Okay, that makes sense.
yeah. So I myself, sometimes I lean towards the almond milk, maybe some oat milk.
There is some controversy and discussion on if these alternative milks are quote unquote healthy.
Yeah, I think we have another podcast brewing in.
Or more to think about for sure.
So can we just talk about here for a minute how one of my favorite things about enjoying my cup of coffee in the morning is how it starts my day off with like feeling happy. I start preparing my coffee. The smell of those coffee grinds, they just hit my nose. And then I'm starting to brew my coffee, and now the house smells like coffee, and now everyone at home is in a better mood. Can we just appreciate that for a moment?
Definitely a mood lifter scent, the actual process, right? So I know for tea, in some cultures and some people, it's pretty similar, especially matcha. So to make the matcha, you have to mix it. It's kind of like a mini ceremony in the morning that I do. I have like this little bamboo whisk for the matcha. A little history I learned about on my ceremony education trip in Japan was that in history, the samurais would prepare matcha as a ceremony before the night before battle as kind of like a ritual, a self-reflection so that they are at peace.
Interesting. So it's a moment of it's a pause to have a moment of reverence, if you will. I love it.
Definitely.
So not only does this moment that we take to enjoy our coffee, I know that my tea drinkers out there, I've heard most of you admit that though you don't like the flavor of coffee, you definitely enjoy that aromatic experience that the brewing of the coffee brings.
I know I have a candle that is a coffee latte scent, and when I light it, it definitely brings me into a positive mood.
Definitely. So talking about mood, did you know that caffeine is an actual psychoactive drug?
Psychoactive? What do you mean by that?
Excellent question. Caffeine is a psychoactive substance, right? And so the definition for this is a drug or other substance that affects how the brain works and causes change in mood, awareness, thoughts, feelings, or behaviors. And let me just throw out some other substances that are thrown in with the caffeine. Are you ready for this?
Ready.
Alcohol, nicotine, marijuana, and pain meds.
Oh, wow.
Yeah. You can also throw in that cocktail some other recreational drugs. I won't list them all.
I know there's some talk about caffeine, usually found in more substantial amounts in coffee than tea. No?
So that's a good point. I think there has a lot to do with the way that the coffee is brewed and the bean that you're using. So a little bit more research to go into that, but yeah, definitely.
As far as caffeine goes, I know throughout my research that one of the populations that it was kind of researched a lot in was in pregnant women, and it showed in tea consumption of less than 2 cups a day in females for reproductive health. There was no significant relationship between caffeine intake and infertility. So that was something interesting that I found because they were measuring, does caffeine affect infertility?
Interesting. So when I was looking into pregnancy and the consumption of coffee, there were mostly controversial studies. I think the conclusion of it all is if you drink it from the beginning and it's part of your existence on a day-to-day basis, it's probably safe to say continue as you usually do. But, unfortunately, if you're a woman with a pregnancy and you have some health conditions happening with your pregnancy, then I'd say you probably gotta stay away. And that's very sad news for some of us who thoroughly enjoy our caffeination regularly.
I know for caffeine research, it was also researched if caffeine had an effect on chronic kidney disease, also known as CKD, for you health people out there. So when they actually looked at the tea consumption of unsweet tea versus sweet tea and the effects of chronic kidney disease based on caffeine, there was no significant difference. And both of them showed low risk of people developing kidney disease with sweet and unsweet tea. There was also a weaker association amongst those that had a slow caffeine metabolism because caffeine can be metabolized differently in multiple people, right?
Yeah, so interesting you bring that up because, as science continues to grow, more and more research is done on genomics and basically the way that our bodies and our different DNA, how they're able to process different caffeine amounts and how we do metabolize in our body. And there's even studies that show, people with a higher sensitivity to caffeine or lower sensitivity to caffeine, and the way that they're able to consume certain amounts of coffee on a daily basis is actually directly linked to some of just their DNA, their underlying genetics, interestingly enough.
I do know that excessive caffeine intake can lead to health problems, particularly an increased risk for your heart problems, cardiovascular problems, and also potential adverse effects of caffeine for coffee consumption in particular. When I was reading the articles, the coffee consumption in certain groups, such as children, sorry, Christina, pregnant women, and those with high blood pressure, hypertension, or diabetes, they found potential adverse effects due to the caffeine in the coffee.
Interesting. So I actually found a study that shows that coffee drinkers who consume more than a cup per day had a lower cardiovascular disease mortality rate than those of their counterpart, those who don't regularly consume. So interesting you find that.
So it sounds like maybe the amount of consumption has something to do with the research.
So a good point. And as we were talking about earlier with the polyphenols, so I think it has a lot to do with that antioxidant property and it has to do with that anti-inflammatory property. And so where does my mind go a lot when I think about inflammation? I think about things like cardiovascular disease. I think about things like diabetes and obesity, insulin resistance. And so I think there's a little bit to speak to when we're talking about the consumption of moderate amounts of caffeine and the risk that it can actually, or I apologize, not the risk, but the benefit that it actually gives to people who may be on their way to these conditions or that may have these conditions.
I think it's great that you brought up diabetes because that is a health problem that we see a lot in the US, in America. I know when I was looking at the health benefits and modern uses of tea, some people use it as management of diabetes related problems and side effects. Also, it shows a potential in preventing Alzheimer's disease, anti-cancer properties, things like that. But also, I saw a correlation in coffee with diabetes. So sources of fluorogenic acids, CGAs, and phenolic compounds have been shown to decrease or inhibit glucose absorption and increase insulin sensitivity. And coffee is recognized as a major source of CGAs and other phenolic compounds.
Interesting. So when I think of the cup of Joe, if you will, I like to keep in mind that, sure, we're worried about diabetes and insulin resistance and obesity. But if you are able to enjoy coffee as is, just from that bean straight to brewed through that with the water and straight to your coffee cup, I think we can probably mitigate some of that concern when it comes to these inflammatory issues that we can experience.
I think this overall topic of coffee versus tea, which one's healthier, also depends on if you have any pre-existing conditions, right? For example, for post-surgery patients, throughout my reading, they tested caffeinated coffee on patients that had invasive bowel surgery. And after the surgery, that group actually experienced more episodes of vomiting and had to get a nasogastric tube placed back and reinserted more often than the group that did not have caffeinated coffee.
Interesting. Dare I say it's probably from that autonomic nervous system response?
It could very well be. Another group is your kidney transplant patients. So a study observed that kidney transplant patients consuming coffee 2 to 3 times a day had higher odds ratio for central obesity. So that's the obesity where they measure your waist and compare it to your height. So your waist to height ratio compared to those that only drink it either 0 or 1 time a day. But they found in kidney transplant patients, there's no association with increased cardiovascular heart disease risk noted.
Interesting. That's good to know. So, what's a topic that I frequently hear, and I always wonder about this? Patient education and coffee. Patients usually ask me, like, how much coffee can I drink? Or can I drink this coffee? And that's always a great question.
Definitely. I know the term moderate is very subjective. What is moderate? Yes, what's moderate to me might not be moderate to you.
Yeah, so interesting. I was reading some studies that show, the consumption of caffeine has some vasoactive properties. It can, prompt some tachycardia, so on and so forth, right? It really activates kind of like that fight or flight. We're going to fight with some caffeine in our system, right? So does it sound like possibly maybe it's not a great idea for them to drink coffee? I think that's an excellent question. I don't know that anybody would provide any conclusive data on this.
Well, for blood pressure management, because that has to do with, vasoconstriction, vasodilation, there has been shown a significant reduction in blood pressure with green tea consumption on top of all the other wonderful benefits that it does. Also, green tea does kind of stop some effects of mice that have high fat diets and type 2 diabetes as well. So it looks like it's a blood pressure help, diabetes help, and possibly help with high fat. It's been shown to prevent body weight gain, insulin resistance, inflammation, also tissue fibrosis. Yes.
Interesting. Well, I might argue that as coffee is a metabolic enhancer, it does help with weight control, and therefore controlling weight also helps to control high blood pressure. Am I allowed to make that jump, or is that a little too far?
Just know that what we're talking about is for entertainment purposes and informational purposes. It's not healthcare advice, but one thing I would like to add is that for tea, there has been some potential benefits shown in reducing liver cancer risk. Actually, not for tea, for both coffee and tea. Potential benefits of reducing liver cancer risk that I found. So that is also something.
Well, may I mention that one of my favorite things about some known facts about coffee is that there was a study done in a populace of patients who drank coffee habitually, and then there were those who didn't. And it was found that there was a substantial difference in the non-diagnosis of dementia Alzheimer's in the patients who regularly consumed coffee. So that's also something else just to keep in the back of your mind.
I think there's some generalized potential in preventing Alzheimer's disease with tea research as well. I wonder what the common factor is. Do you think it's the polyphenols?
I think my conclusion is most likely it has to do with some polyphenol antioxidant properties.
For sure. Tea also has a lot of bioactive compounds that could also be a benefit to the health as well. So, Christina, after our debates on coffee versus tea, which one do you think has more pros or cons?
Well, Caroline, I think that's an excellent question. I think ultimately who's going to win this argument is the palate of the person who is consuming.
Definitely. For our listeners out there, we definitely want to hear what your opinion is after listening to our little debate here, weighing in all the pros and cons. Which one do you think is healthier, coffee or tea?
I think we all know which one I'm sticking with.
For sure.
Well, after all this talk of coffee versus tea, I think it's time that Caroline and I go ahead and sit back and relax and enjoy our hot cup of coffee and tea.
Tea, for sure. So now that we are at the end of our episode, let's do our little outro. So, Christina, where can everyone find us on social media?
So, on social media, you can find us at the Healthiest Argument Podcast. You can find us on Instagram, Spotify, TikTok, and YouTube. Don't forget to subscribe, follow, and like
At Healthiest Argument Pod.
You guys, it's been great doing this podcast. We hope to hear your feedback. We really love to hear what you have to say.
See you for episode 2.
Bye.
Bye. Thank you for listening to this week's episode of the Healthiest Argument Podcast.
Visit us on social media to vote coffee or tea and comment what you would like the next healthiest argument to be.
Don't forget to like, subscribe, and follow for more content.